The NHS is the fourth greatest employer in the world, behind the People's Liberation Army of China, Asda Walmart and the Indian State Railways. However, the NHS is drifting from a national treasure to a privatised gold mine. This is following the news in July 2010 that the Nazi Tories, alongside their ass-licking Liberals, are looking at letting go 100,000 frontline NHS staff such as doctors, nurses and general practitioners throughout the United Kingdom, despite government promises to protect the NHS from cuts. In addition, cuts of £20 billion have been announced, bringing into question whom is actually going to plug the financial gap. Well, quite simply, it's going to be the private industry. The underlying issue is, patient admissions are increasing year on year, and reducing critical and crucial investment in the NHS is simply going to crumble to its American alternative. Further to this, it's quite interesting to learn that over 75% of new NHS buildings are financed by the private sector, much like our schools and colleges, where the government ominously rents their own buildings somewhat. This wasn't happening 10 years ago. This is all very convenient for a government that wants immediate change, but this incompetence lies in its radical and untoward financial fascism. Where's the democracy in this budget? At what point do these gullible totties actually vote Conservatives to expect such dramatic adjustments to their public services? It lies in this. General practitioners are not managers. The National Health Service is no more. It will now be a meagre clinical dungeon to the poor and deprived. The National Health Service will be the new tough luck alternative in times of need, the place you get dumped into, the beggar's delights, the chamber of compromised healthcare somewhat. Ladies and gentlemen, this is soon not to be the National Health Service. This is the NHS, now heading south. Do your bit to save the Tories raping your treasured health service. Sign our petition at yoursoapbox.com.